Here's the truth. Those morning sugar spikes aren't just how your body is. They're the #1 silent sabotage in type 2 and prediabetes, raising A1C, draining energy, and pushing you closer to complications. The good news? One overlooked vitamin can flatten that spike and keep your numbers steady all morning. In minutes, you'll see exactly what to take, how much, and the best timing to calm that dawn surge and support your insulin response. Let's begin with the one most people are missing and don't realize is driving those AM highs. While most people associate it with bone health, this nutrient plays a much bigger role. Vitamin D helps your pancreas release insulin effectively, and when levels drop too low, that release becomes far less efficient. With weaker insulin output, glucose lingers in the blood instead of moving into the cells where it's needed, particularly during those critical hours after waking. A surprising number of people have insufficient vitamin D without realizing it. Older adults are especially prone since the body's ability to make it from sunlight declines with age, and fewer hours outdoors add to the problem. Even moderate deficiencies can make insulin less effective. Research shows that low vitamin D levels are linked to metabolic risk factors like higher body mass, higher blood pressure, elevated triglycerides, and insulin resistance, all of which increase the chance of developing type 2 diabetes. This is more than association by chance. It highlights vitamin D's central role in glucose control. Clinical findings reinforce this. A meta-analysis of people with type 2 diabetes reported that vitamin D supplementation significantly reduced HbA1c, a marker of long-term blood sugar regulation. The same study also observed lowered fasting glucose when vitamin D deficiency was corrected. Subgroup results showed even stronger outcomes in younger people with diabetes and individuals of lower body mass index, pointing toward a true biological benefit rather than just numbers on a chart. So, what's the right amount to take? For many adults, 1,000 to 4,000 IU daily is considered both safe and effective for preventing deficiency. However, reaching optimal blood levels, around 100 nanomoles per liter, often requires higher doses, in some cases up to 8,000 international units for adults, depending on body weight and health needs. Because requirements vary widely, it's best to discuss the appropriate dosage with a healthcare provider. While foods like salmon and fortified dairy plus sun exposure can help, they rarely provide enough to restore ideal blood levels without supplementation. A simple tip: since vitamin D is fat-soluble, taking it with a meal containing some healthy fat can improve absorption. But insulin's effectiveness also hinges on another nutrient that helps unlock sugar from the bloodstream, one that many people fall short on without realizing it. Magnesium is often called the mineral that powers insulin, and for good reason. Without it, the body struggles to move glucose out of the bloodstream. This mineral acts as a cofactor in more than 300 enzyme systems, including those that regulate how insulin is secreted and how cells use sugar for energy. Magnesium helps activate glucokinase, a key enzyme that signals cells to take up glucose. It also influences ATP-sensitive potassium channels in the pancreas, which are essential for releasing insulin at the right time. When magnesium is low, both of these processes falter, leaving glucose circulating in the blood instead of being stored or burned for energy. The problem is that deficiencies are surprisingly common, especially in older adults and people with type 2 diabetes. Modern diets high in processed foods strip away magnesium, leaving many people chronically short without realizing it. Clinical research has shown how much of a difference restoring it can make. A meta-analysis that examined 24 randomized controlled trials found magnesium supplementation significantly lowered fasting plasma glucose as well as HbA1c, the long-term marker of blood sugar control. Those already starting with low magnesium levels and individuals who maintain supplementation for at least 90 days experience the most noticeable improvements. Magnesium's effects extend beyond glucose uptake. It strengthens the way muscles and liver cells store sugar, making insulin signals more efficient both after meals and overnight. That storage helps stabilize fasting glucose, which explains why consistent supplementation over several months produced greater results. Research also shows that magnesium has cardiovascular benefits, with supplementation helping reduce both systolic and diastolic blood pressure, a key factor for people managing diabetes. You can increase magnesium through diet with foods like leafy greens, nuts, seeds, and whole grains, but when the goal is therapeutic, supplementation often provides a clearer path. Instead of focusing on one fixed dose, it's helpful to consider study-based ranges. For blood sugar management, benefits appeared across a span from about 200 milligrams to just under 500 milligrams daily, with higher dosages around the 400 to 500 milligram range linked to stronger improvements in HbA1c for type 2 diabetes specifically. Since individual needs vary, it's best to talk with a healthcare professional before starting, especially if you take other medications. Magnesium reduces the strain glucose places on you, but sugar control isn't the only challenge. Comfort and function matter too, particularly when nerve health begins to interfere with your mornings. Beyond diet, what if the discomfort you feel in your feet or hands each morning is a silent signal that one overlooked vitamin is holding your blood sugar management hostage? That vitamin is B12, and its role in protecting nerve health is critical, especially for people living with type 2 diabetes and taking metformin long-term. While metformin remains one of the most widely prescribed diabetes medications, its continued use often reduces vitamin B12 levels, with deficiencies commonly appearing after 4 or more years. Studies suggest that B12 deficiency in type 2 diabetes may be present in over half of individuals, and the consequences go far beyond fatigue. It can worsen or even mimic neuropathies that interfere with comfort and function. These include peripheral diabetic neuropathy, loss of sensation and tingling in the feet and legs, autonomic neuropathy, affecting functions like blood pressure and heart rate, often referred to as cardiovascular autonomic neuropathy, and painful neuropathy, burning, stabbing sensations that disturb daily life. The reason this matters is simple. Neuropathy doesn't just create discomfort, it changes how you move and how your body reacts to stress. Reduced activity from pain lowers insulin sensitivity, while pain itself raises stress hormones that can push glucose higher. So while B12 may not directly drop blood sugar like some nutrients, it addresses the obstacles, pain, numbness, and poor mobility, that make stabilizing glucose more difficult. A clinical trial looked at this connection in detail. 90 people with type 2 diabetes, all on metformin for at least 4 years, with confirmed low B12 levels, were given 1,000 micrograms of methylcobalamin daily. After 12 months, those taking B12 showed marked improvement across multiple measures. Their vibration perception, a key indicator of sensory nerve function, improved. Pain scores dropped, signaling less daily discomfort. Quality of life assessments rose. Objective measures such as sural nerve conduction velocity and amplitude also improved, showing better nerve signal transmission. Even pseudomotor function, which affects skin health and helps prevent diabetic foot complications, was restored. In contrast, the placebo group experienced significant declines in nerve function and worsening pain. Interestingly, HbA1c levels did not change, highlighting that the benefit of B12 lies in protecting comfort and function rather than lowering glucose directly. Dietary sources like fish, poultry, eggs, and dairy help maintain B12, but once deficiency sets in, especially with long-term metformin use, diet is rarely enough. Supplementation becomes key, with a 1,000 microgram daily dose of methylcobalamin both safe and effective for correcting levels. Taken with breakfast, it's simple to incorporate alongside other medicines. With B12 easing the discomforts that complicate daily life, the next question is how to control the sharp rise that often comes after meals, an area where another well-studied vitamin has shown remarkable results. What if you could lower the strain your body faces after eating, not by changing your meals, but by adding a nutrient most people already know by name? That nutrient is vitamin C, and its role in controlling post-meal glucose has become increasingly clear. Most often linked with immune support, vitamin C also works as a powerful antioxidant, and that makes it especially relevant for the hours following a meal when glucose tends to surge. In a clinical trial, daily use of 1,000 milligrams of vitamin C was shown to improve post-meal control significantly. Participants reduced their time spent in high blood sugar and, more precisely, saw post-meal glucose levels drop by 36% when measured as incremental area under the curve, IAUC. For context, that means there was a measurable reduction in the extent and duration of post-meal blood sugar rises, effectively cutting hours of vascular stress across the day with a nutrient that is both accessible and affordable. How does it work? After eating, blood glucose rises quickly and oxidative stress increases at the same time. This stress is harmful because it damages the endothelium, the thin protective lining of blood vessels, making it harder for circulation to adapt. Vitamin C reduces oxidative stress, including measurable reductions in markers such as F2 isoprostanes. By lowering these indicators of oxidative strain, vitamin C indirectly supports healthier vessel function and helps your body move glucose from the bloodstream into tissues more effectively. The result is steadier blood sugar management with less damage over time. Fruits and vegetables like oranges, grapefruits, strawberries, kiwis, and bell peppers naturally provide vitamin C, and they are excellent for general health. However, reaching the therapeutic levels that improved glucose handling in studies typically requires supplementation. This study notably used 1,000 milligrams per day, often delivered as two 500 milligram doses with meals, like breakfast and dinner, for consistent daily benefit. An additional advantage is that vitamin C supplementation has also been associated with lower blood pressure, another frequent concern for people managing diabetes. It means that with the simple step of pairing your meals with vitamin C, you are addressing both glucose regulation and cardiovascular risk at the same time. But while vitamin C improves your body's response after eating, there is also the question of how insulin's signal itself works at the cellular level and whether that system can be reset when it starts to fail. When insulin is present but your cells fail to respond, the problem isn't just about how much insulin you make, it's about whether the signal is getting through. This is where Myo-Inositol, sometimes referred to as vitamin B8, becomes important. Acting as a second messenger, it helps transmit insulin's instructions inside the cell. When Myo-Inositol is lacking, the pathway breaks down, and glucose stays in the bloodstream instead of entering the cells where it can be stored or converted into energy. In insulin-resistant states, that breakdown is easy to see. The pancreas is producing insulin, but cells aren't responding as they should. That means glucose stays circulating, driving fasting numbers higher and slowing glucose clearance after meals. Researchers have studied Myo-Inositol to see if supplementing it could restore the missing signal, and the findings have been encouraging. Clinical studies, especially in people with insulin resistance and women with PCOS, show consistent benefits with supplemental Myo-Inositol. In fact, some trials found that Myo-Inositol improved insulin resistance approximately twofold more than certain prescription drugs such as pioglitazone or metformin. A typical therapeutic dose was 2 grams daily, and the results included steadier fasting blood sugars and better post-meal responses. Unlike medications that act quickly, the improvements build gradually, usually taking a few weeks to appear and continuing with sustained daily use. You can find small amounts of inositol in foods like beans, seeds, and cantaloupe, but dietary sources don't provide enough to match what has been used in clinical studies. That's why supplementation is usually recommended. Convenient options include powders that dissolve in water or capsules. For the best effect, most protocols use 2 to 4 grams daily, split into 2 servings. A common approach is 2 grams in the morning and another 2 grams in the evening with meals. This schedule helps maintain a steady influence on insulin signaling across the entire day and night, rather than letting levels swing with a single large dose. Think of Myo-Inositol as repairing the damaged connection between insulin and the cell's response. Once that line of communication is restored, glucose can move efficiently inside cells, making fasting levels more stable. Yet insulin signaling is only part of the picture. Another pathway of control works outside the cells altogether, originating in the gut and reshaping how your body manages blood sugar from a completely different angle. Vitamin K2, especially in its MK7 form, has emerged as a surprising factor in controlling morning glucose. Long known for its role in bone and cardiovascular health, research now shows that it also influences blood sugar regulation through its impact on the gut. Specifically, vitamin K2 helps foster the production of short-chain fatty acids, SCFAs, and secondary bile acids, SBAs. These compounds act like messengers, traveling from the intestine to the liver and pancreas, where they influence how glucose is processed and insulin is used. One of the most important studies on MK7 followed participants over 6 months. Those who supplemented with 90 micrograms of vitamin K2 daily saw their fasting glucose drop by about 13%. In addition, HbA1c, a marker of long-term sugar control, decreased by 0.6%. These results are notable for a simple daily step using a nutrient that remains largely outside routine medical conversations. It highlights that sometimes overlooked nutrients can provide measurable benefits to glucose control. The mechanism behind these results centers on hormone regulation. Vitamin K2 has been shown to increase GLP-1, a hormone involved in balancing blood sugar. GLP-1 enhances insulin sensitivity and slows the pace of digestion, which helps maintain steadier blood sugar after eating and may reduce the spikes that often complicate morning readings. Together with its effect on SCFAs and SBAs, MK7 works as a bridge linking gut microbes, hormones, and metabolic processes into a more stable system for blood sugar regulation. Dietary sources of MK7 are limited. Natto, a traditional Japanese fermented soybean dish, is the most concentrated source, while certain aged cheeses and egg yolks contain smaller amounts. Because these foods are not common in most daily meals, supplementation becomes a practical option. The clinical research specifically used 90 micrograms per day with meaningful outcomes, making that dose an evidence-backed place to start. Future research may clarify whether higher amounts offer further advantages, but current data supports daily intake at this level. Taking it with a meal that includes fat can help improve absorption. These nutrients are powerful, especially vitamin K2, but they're only half the story. What you eat at lunch can either lock in these benefits or wipe them out completely. That's why I put together a brand new video you'll see on screen now. It walks you through the 5 best lunch foods to avoid crashes, cravings, and sugar spikes. Click now to protect the progress you made and keep your numbers steady through the rest of the day.